Back to our coverage of the coronavirus here in Connecticut. We are your vaccine authority, and as more people get the shot each and every day, we're helping you get answers to some of your questions. And if you come up with one right now during the interview, you can scan the QR code that you see right there at the bottom of the screen. Just open your camera. It will take you right to a page where you can send us your question. Joining us live again this afternoon is Dr. David Banach, head of infection prevention, hospital epidemiologist at UConn Health. Doctor, thank you very much. Good to see you again.
Nice to see you again.
Well, let me get right to our first question right here. This just came in today. So what happens if you have COVID but don't know it and get your first or second shot? Is that dangerous, or could the shot help you fight it off?
So, that's an interesting question. I think what we know is that people who have had COVID in the past, including the recent past, can still get the vaccine. And it doesn't seem like that has any direct effect on the ability to fight against the active infection. It does seem like those who have had COVID in the past and get vaccinated may have a little bit more in terms of side effects than people who haven't had COVID in the past. But, in general, it wouldn't be a contraindication. And, I think if you're feeling well and you're not having symptoms, by all means, you can go ahead and get vaccinated and move forward from there.
All right, well, that's certainly good to know right there. Now, Neil from Manchester is asking, why are some people being asked if they have Botox or facial fillers before they get their vaccine?
So thanks for that question. Actually, a few people have asked me that question recently. As part of the standard screening questionnaire, there is a question about have you received fillers? And that's actually based on in the early clinical trials that were done last summer, there were I think 2 or 3 patients, a very small number out of the many thousands, tens of thousands of people who developed some facial swelling. And when we looked into their history, they had a history of some Botox to the face. So there was some concern initially that was going to be an issue, that people who have had Botox may be at a higher risk for getting that facial swelling. Since then, the American Society of Dermatology Surgery has actually weighed in and evaluated the data and has concluded that there really isn't that increased risk that was the initial concern up front. So those kinds of facial dermal fillers are not considered a contraindication or need any special measures. When those kinds of situations do occur, which again are exceedingly rare, they can be managed with medications, and patients will do fine. So initially a concern, now it seems to be less of a concern, and if it were to happen, very manageable.
Well, we're certainly learning more as we all move through this process together, that's for sure. Our last question for today, if I'm taking antiviral medication, is it okay to get the vaccine?
So good question. People take antiviral medications for all different kinds of reasons. I think generally speaking, the antiviral medications wouldn't be any sort of contraindication to getting a COVID vaccine. Sorry about that.
That's all right.
But I think when it comes down to it, you just want to be clear that the reason that you're taking the antiviral medication isn't an issue. So I think I would check with your doctor for the specifics, but generally speaking, the medications themselves wouldn't affect the way that your body would respond to a vaccine. But, I would double check and ask the doctor who's prescribing the antiviral medication before you proceed.
All right. Certainly good to keep in mind, and no harm done there. It's like we're FaceTiming with family. The cameras fall. Things happen, doctor. Don't worry about it.
Thanks for understanding.
We'll see you soon.